Hello.
Live streaming is on.
क्या हुआ है?
Hello.
Madam, start the program. She's starting, madam. She.
Good evening, guests and all respected people. I think Merlin is having a little trouble coming right in. As soon as she comes in, I will hand over to her because Dr. Merlin is taking care of the evening. So I really thank all of you to find time here. We have dignitaries all the way from Special Olympics Asia Pacific, from CBSE, from of course our own IDA, and we have S.O Asia Pacific, S.O Bharat. We have Cornell University being represented by Professor Datta is here from Cornell. And of course, we have all the dignitaries of CBSE. Rupali, can you please confirm if Merlin is in a position to take over the program?
Yeah. Hello.
Yes. Thank you, Merlin.
You say now. I'm not able to.
We have Dr. Swasthicharan.
Is anybody able to listen to me?
Thank you so much for being here. We have Dr. Swasthicharan here. Yes, Merlin.
Merlin, you are audible.
Merlin is just having some technical issues. She's just disconnecting and reconnecting back again. I think she's having some internet connectivity issues. So I'll make a quick round of introductions in the meanwhile. So we have from our IDA head office, our president, Dr. Ravinder Singh. He's a dynamic person. He's here with us. Then we have Dr. Rajiv Chok is here with us. Dr. Dhoble should be joining in any time. From the CBSE, we have Dr. Biswajit Saha, we have Dr. Emmanuel Joseph, and we have, of course, Dr. R.P. Singh. From Special Olympics Bharat, we have Mukta, we have Mukta Thin, we have Dr. Amitabh Mishra, we have Mr. Victor Vaz who joined us.
Hello.
And,
am I audible?
Yes, you are. Thank you for coming in. Thank you. Let's start. You're perfect. Rupali, she's fine. She can just start.
मैं आपका नेटवर्क शायद नहीं है.
फोन से ज्वाइन कर लेते क्या? We can start with the phone.
Yes, please.
Rupali, we can hear you.
हो गया क्या ये ले चल नहीं हो गया थम हॉटस्पॉट से ले लेना स्टार्ट देख हो रहा है क्या एक मिनट मैं बक देख रहे हैं इतने जॉइन मीटिंग की करता हूं आले दिखे नहीं मैं हॉटस्पॉट लेना यस मैडम हाँ अच्छा ओके 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 हाँ ठीक है Okay. She's going to start. They are able to listen.
मैम हम लोग फिर बोलेंगे मेरे को कुछ भी नहीं सुनाई देगा ना.
हाँ, but I'm logging from this now.
Rupali, we can hear you. That's what I was trying to say.
Yeah, you will. Just a minute, madam. She's starting, madam.
Looks like I will have to take over till she can come back again. So I'll continue with my round of introductions. So we have our Managing Director and President from Asia Pacific Office of Special Olympics. We have Mr. Dipak Nitali. We have Dr. Amitabh Mishra, who is the General Secretary and Acting CEO from Special Olympics Bharat. We have Mukta Narayan Tind, who is the National Director Organization from Special Olympics Bharat. And I think I saw Victor somewhere here. Victor, are you here? I think I saw Victor, yes. And I see Varun is here. So Varun is our Healthy Athlete Manager from Special Olympics. So this is my Special Olympics. And we have Raman here, who's coming. She's the Head of Communication. And so that's Raman Rekhi is here with us. I think Rupali is seriously having a lot of problems there. Marlene,
yeah, hello, ma'am.
Yeah,
ma'am. I'm here. I'm here on my phone. Yes. Yeah. Sorry for the little delay in joining the meeting. Yes, so we go ahead. A very good evening to each and every one of you present here with us today. I, Dr. Merlin Vijla, Project Coordinator, NOHP IDA, welcome you all to the inaugural ceremony of IDA Digital School Oral Health Education for CBSE and S.O. Bharat registered schools. On the occasion of World Oral Health Day, Indian Dental Association initiates the Digital Oral Health and Sports Safety Education in collaboration with CBSE and S.O. Bharat National School Oral Health Program for all schools across India on the IGASIA Connect. Without further ado, please allow me to introduce to you Dr. Ravinder Singh, President IDA-HO. Dr. Ravinder Singh has been a voice of IDA in the anti-tobacco campaign for several years. He has also been associated with the legal and policy-making aspects of tobacco control in Assam since 2009. Now, may I please request Sir to please give the welcome address.
Thank you, Rupal. Am I audible?
Yes, sir.
Chief guest of the evening, Honorable Education Minister, Government of India, Shri Ramesh Nishant ji, Honorable Minister of Health, Government of Maharashtra, Shri Rajesh Tope ji, Honorable Minister of School Education, Government of Maharashtra, Srimati Varsha Gaikwad ji, Guest of Honor, Mr. Manoj Ahuja, Chairperson CBSE, Dr. L. Swasthicharan, Chief Medical Officer, Directorate General of Health Services, New Delhi, and a special guest, a very dear Air Marshal Keelor, CEO and Founder Trustee, Special Olympics Bharat, Mr. Dipak Nitali, MD and the President of Special Bharat, Special Olympics Asia Pacific, Professor Dr. Sumitra Datta, former Dean of S.C. Johnson College of Business, Cornell University, my dear panelist, Dr. Ashok Doble, Honorary Secretary General, IDA Head Office, Dr. Bishwajit Saha and Dr. Joseph Emmanuel from CBSE, Dr. Amitabh Mishra and Mrs. Mukta Thind and Victor Vez from S.O. Bharat, and finally, the dynamic lady, Dr. Reena Kumar, convener of National School Oral Health Programs, IDA Head Office, Dr. Rajesh Tope, Dr. Manish Sharma, Dr. Malin, and my dear friends, colleagues, and participants. Welcome to the inauguration of the IDA Digital School Oral Health Education Program with CBSE affiliated schools. Please accept warm greetings from Indian Dental Association on the occasion of World Oral Health Day, which is celebrated on on 20th of March, but we are doing this program on the virtual mode today, the 23rd of March. As we all know, Indian legislation is the authority voice of the dental professionals in India, and it aims at oral examinations and advise every student, every teacher whenever required and necessary. The children are the future of the nation, and so nurturing them would be essential if we are to achieve our basic vision of optimal oral health for all in this country in the very near future. Today, I am proud and delighted that this much awaited ambitious program would be launched and inaugurated by the distinguished dignitaries through this virtual mode. With these words, I extend my best wishes to this prestigious project, benefiting all the school children and finally the future of this great nation. Thank you all. Jai Hind, Jai IDA. Over to Marlene, please.
Thank you, sir. Thank you for your words. Before we proceed with the program, I would like to make a special mention for Air Marshal Keelor, CEO and Founder Trustee, S.O. Bharat. Sir has been a great support and a backbone in the planning and implementation of today's program. Though he is unable to connect with us today, he has sent us his well wishes and blessings for the success of this program. Thank you, sir. Next, we have with us Mr. Dipak Nitali, Managing Director and President, S.O. Bharat, Asia Pacific Region. Mr. Dipak has been involved with Special Olympics since the year 2006. He oversees the operations in over 35 countries in the Asia Pacific region, providing strategic direction and engagement in both private and public sector. May I kindly request you to speak a few words?
Certainly, Dr. Merlin. I hope you can all hear me well. Thank you so much for inviting me to today's ceremony and celebration. World Oral Health Day is obviously an incredibly important day. I say this from the perspective of having been with Special Olympics for so many years and understanding that whilst we are traditionally seen as a sports organization, our work in the area of health, and in this case, oral health, is incredibly important, not just to our athletes, but to the way in which you as individuals involved in healthcare or within the education sectors, or indeed the non-profit sectors, can see the way in which not only sport, but the needs of people with intellectual disabilities outside the realm of sport, particularly within healthcare, needs to be addressed. What is really noteworthy over today's celebrations is the commitment that I see from so many people. When I hear the figure 21,400 schools, I think it is incredible to see the level of commitment from everybody to supporting such an underprivileged and impoverished community that people with special needs form. So I would just like to say I'm delighted that this engagement, this partnership is something that we are celebrating today, and long may it continue, and anything that Special Olympics Asia Pacific can do to support Special Olympics Bharat and all of the different people involved in oral healthcare across India to develop and grow is something that we look forward to being able to do. So thank you very much.
Thank you, sir. Now, with great pride, I introduce to you the first panelist for today's program, Dr. Biswajit Saha, Director, Skill Education and Training, CBSE. He manages skill curriculum designs, development of student resource books and training manuals, and monitors the execution of various teacher training programs for 16 CBSE Center of Excellences. He is also representing the CBSE in various national and international committees. I kindly request you to say a few words, sir.
Thank you, Dr. Marlene. I think it's a great occasion. First of all, our compliment to all the office bearer of IDA on the occasions of World Oral Health Day. It's a great moment for all of us. All the dignitaries special guest of honor, and of course my colleague from CBSE, and our school student, CBSE school leaders, teachers, and Special Olympic schools functionary, as well as their representative from different schools. So I think this is a matter of pride as well as celebration. The way institutional arrangement are being made to celebrate this occasion. And this institutional arrangement is not only help the country in future, rather this baseline have started between the professional and the schoolgoers. So one way it is a kind of collaboration, and other way how we can really gear up the campaign for that world oral or health as well as sports dentistry. I think I was going through a few minutes back the theme of this year or even next year. I have seen that theme is be proud of your mouth. So I think each one of us here who are sitting through this EGCA platform, thanks to Professor Datta, giving this wonderful idea of school room. So it is an integrated LMS through which I think the professional, multiple professionals who are registered with IDA. And in fact, through this platform, I would like to request the office bearer, especially President and General Secretary of IDA, to connect with multiple dental colleges in India. I think those who are already practicing by arranging their professional time, besides the undergoing student who are already in the BDS program or MDS program, how they can be roped in this mission so that every child may not be only CBSE or Special Olympics who are connected through the platform. Maybe we should reach all the state government school students, all the Anganwadi to all senior secondary schools. So with a mission mode, if we try, I think it would be a great success for the country, and we can make proud of our associations in long run. Thank you very much, and wish you all the best. And I think more schools from the CBSE family are going to join in this platform. And I think with your experience and expertise, the benefits is going to be extended to every family members who are associated with us. And in fact, all school going children are going to benefit. Thank you very much. Namaskar.
Thank you for your kind words, sir, and also enlightening us with all the different, different things that we can, possibly do with our program. And thank you for being here with us today. The second panelist for today's evening is Dr. Joseph Emmanuel, Director, Academics, CBSE. Dr. Joseph Emmanuel played a pivotal role in bringing innovation in the field of educational administration, such as integration of technology with the examination system, e-affiliation, training and capacity building for teachers and students, etc. As an officer on special duty, he has successfully introduced the NEET, that is a National Eligibility Cum Entrance Test, for MBBS and BDS courses in the country. May I request you to please speak a few words, sir?
Thank you, Dr. Merlin, Dr. Devendra Singh, Dr. Reena Kumar, all the dignitaries joining me on this platform in this evening, my colleague Dr. Saha, all the teachers and students. So it's a very, very happy and encouraging moment that for celebrating World Oral Health Day, Indian Dental Association as well as Special Olympic Bharat has come out with this program of oral health in the CBSE affiliated schools. So CBSE has schools across the country, 25,000 schools from government as well as the private sector. And to begin with, we are very happy that you have chosen CBSE as a partner. And with this initiative, I am sure this movement will spread across all the schools in the country. because the national education policy very clearly recommends overall development of the child, developing a child as a well-rounded adult or a citizen. That is the objective of education. To achieve that mission and objective, Indian Dental Association's effort is really commendable. Without oral health and hygiene, a child cannot be groomed as a well-rounded citizen. And the importance of dental health, oral health and hygiene is known to everyone in this platform, but to take this message to the last child in this country, that should be our aim and objective. In that direction, I request the Indian Dental Association as well as the Special Olympic Bharat, you may please direct your resources and channelize your capabilities so that the entire children in this country will be benefited out of this scheme. My best wishes and compliments to all the office bearers of this program, all the think tanks, those who are working for the success of this program, and those who have joined this program for implementing on the ground. Thank you very much. Best wishes.
Thank you, sir, for giving us the opportunity to work with the CBSE board so closely. Next panelist for today is Mrs. Mukta Thind, National Director, Special Olympics Bharat. She is an experienced national director with a demonstrated history of working in the non-profit organization management industry. She is also skilled in business development, strategic planning, event management, journalism, and change management. I request ma'am to please say a few words.
Thank you so much. First of all, congratulations to IDA and champion of the cause, Dr. Reena Kumar for S.O. Bharat. The platform given to us today is not a surprise, I would say, because IDA has stood by S.O. Bharat in the previous years as well, when we celebrated EKS Day for 6 months, providing not only the education but also oral health care to the special athletes. And today this program brings this platform to about 100 schools who are registered with S.O. Bharat, and which I'm sure will grow as the time comes in. So thank you so much, Dr. Reena, IDA, and CBSE for collaborating on this platform. And we look forward to the future of best oral health education and care for our special athletes. Thank you so much.
Thank you, ma'am. And IDA is privileged to be a part of this massive campaign that we are running. And we are glad that we are a part of you and you are a part of us. With great pleasure, I introduce to you our special guest for today's event, Professor Dr. Soumitra Dutta. He's a professor of management and former funding dean of S.C. Johnson College of Business, Cornell University, president and co-founder of Portlunas Institute, chair board of directors at Global Business School Network, former chair board of directors at AACSB International, founding editor of the Global Innovation Index, founding co-editor of the National Readiness Index. He is the co-founder of IGESIA Connect Digital Live virtual platform for education and collaboration. We extend a heartfelt gratitude for gifting IDA the IGESIA digital platform through which the National School Oral Health Program will run. Thank you, sir. And may I also ask you to please speak a few words.
Thank you very much, and a very good evening to all distinguished guests and panel members. For me, it gives me great pleasure and honor to be part of this distinguished gathering. For me, the future of the country is the #1 priority. And of course, as Dr. Singh correctly said, children form the future of our country. And if we can do our own little bit to help better the environment in which they grow, their own personal health, I think it's a tremendous contribution that we can collectively make. And I'm very grateful for the opportunity you have afforded IGACIA to be part of this effort, along with great institutions like IDA, Special Olympics, and CBSE. I'm not a medical doctor. I come from the world of business schools, and I teach about technology innovation. And my dream and vision is to essentially use technology to help bring some of the benefits in health and education to the enormous number of people we have in India who can benefit from this knowledge and experience. Reaching the UN's Sustainable Development Goals in these areas of health and technology is possible, of health and education is possible, but that is only possible with the help of the potential of new technologies. So I'm very pleased that IGACIA Connect is a small part of this journey. IGACIA Connect is available for free for all of your institutions. It is a platform not just for a video meeting and for holding an event. It is also a platform that integrates all the learning features, all the different requirements that a university or an organization has in curating a community. So you can actually keep your community on this and integrate them into your day-to-day activities. So I encourage you to try it, and it's a distinct pleasure, once again, an honor to be part of this important event. Thank you very much.
Thank you, sir. Thank you for all the help that you're providing us with this particular event and also this particular program that we are conducting. Yeah. Now we have with us Dr. Ashok Doble, Honorary Secretary General, IDA-HO. Dr. Doble has been instrumental in promoting and implementing numerous health initiatives across the country. Few of his contributions include the Oral Cancer Foundation, National Oral Health Program, National Oral Cancer Registry, Child Oral Health, etc. He is an advisor to the Government of Maharashtra, Department of Public Health to the FDI Council. May I kindly ask sir to please speak a few words?
Very good evening to all of you, and I'm very happy, and it is a matter of pride for the Indian Dental Association. So many organizations, they are coming on the single platform to improve the oral health or to have the optimal oral health for all the people in the country. And we have kept the focus to start with all the schools in the country. And this is the first program we are initiating through the CBSE school. And I would like to thank all the authorities and particularly our Honorable Education Minister for giving us the consent to conduct this program. And our plan is not only to limit just CBSE school, to go to the entire country, all the state government schools, municipal schools, private schools, and to teach the children, parents, and the teachers, to how to take care of the oral health. And oral health is a mirror of the body. Everybody knows. Oral health, it doesn't require much attention, or it doesn't involve, it is not the costly any affair. In a year, you require 4 brushes, 4 toothbrush, and 4 toothpaste. This is what the preventive care to take. But how to brush the teeth? Twice a day brushing, and twice a year, just normal checkup to the dentist. It can prevent all the dental diseases in the entire life. So our ambition, our motto is to take care of the first, to begin with the children's, then we'll go to the college level, then the parents and senior citizens. And to make the healthy India, happy smile, healthy smile, on this concept, IDEA is working, and we want to achieve by 2032 have the the healthy teeth and healthy smile. So without taking much time, I would like to thank Dr. Reena and all the stakeholders in this activity. Jai Hind, Jai IDA.
Thank you, sir. The next speaker for today is Professor Dr. Amitav Mishra, General Secretary S.O. Bharat. He is currently working as a professor at Indira Gandhi National Open University, New Delhi. Dr. Mishra has been providing active voluntary services to Special Olympics since the year 2004. Dr. Mishra is a member of the Special Olympic Global Advisory Committee of MATP, that is Motor Activity Training Program. He serves as an associate editor at the Oxford University Press Research Encyclopedia, Inclusive and Special Education, New York, USA. Can I kindly ask you to speak a few words, sir?
Thank you very much. I'm really honored to be part of this inaugural session for World Oral Health Day. I would appreciate the way the technology has come and it has connected three important partners, that is Indian Dental Association, CBSE and Special Olympics. So as my colleagues have already mentioned that Special Olympics has been very intensively working with the health aspect of our special athletes, and oral health has been a very important program as a special smile. So I would congratulate IDA for joining hands with IGESIA, because without technology it's very difficult to this is the new common new normal of this 21st century. We have to have lot of activities. Everything can be happen virtually, so that's a great platform. So I'm really amazed with that platform can connect so many large number of schools, So my gratitude to IGESIA, my gratitude to IDA, and also I'm really thankful to Dr. Reena. She has connected Special Olympics so intensively with this program. I have 2-3 important I'll just bullet point it. Number one, I work in promoting inclusion. So I'm really thankful for IDA connecting CBSE and Special Olympics on this important platform. As you know, Special Olympics is spirally embedded with all the school activities, that is for promoting sports of children with special needs. And also we work in a unified manner. We connect with our athletes even without disability, because we talk about inclusion. And our athletes are not only in the special schools. Now they are very much in inclusive schools that being run by CBSE. As you know, CBSE is the largest school affiliating examination body in the country. So we really look forward to have a great interaction with the CBSE. I have been part of the CBSE in their inclusion policies, guidelines. So we look forward to have more and more involvement of CBSE, Special Olympics, IDA for this particular, not only in the health inclusion, because in the school, when you talk about inclusion, we talk about scholastic inclusion, that is academic activities. We talk about social inclusion. We talk about post-scholastic activities. We talk about the physical education inclusion in the sports, and we talk about inclusion in the health activities. So this is the great platform and great opportunity that IDA and IGESIA has given to Special Olympics to promote the concept of inclusion because we have large number of CBSE schools. We have been connected through our unified programs. We have a lot of unified youth, typical youth who have joined Special Olympics. They're taking really leadership role. So I think this will be a great platform, not only to educate our special athletes, our typical athletes, or the school children about the oral health, but also this is a platform to promote inclusion. So I'm again thankful to all of you for giving this opportunity and this honor to be part of this inaugural session. Thank you very much.
Thank you, sir, for being present with us today. It gives me immense pleasure to introduce the first guest of honor, Dr. L. Swasthicharan. Dr. L. Swasthicharan currently leads 3 national-level non-communicable diseases program as the Directorate General of Health Services, Ministry of Health, Government of India. The National Tobacco Control Program, the National Oral Health Program, and the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases, and Stroke. His main interest is in operational research. In the PH Leadership Program, he expects to learn about prioritizing public health issues based on evidences and practices from across the world, and to try to adapt and implement them in the national program for management of NCDs in India. Can I kindly ask you to speak a few words, sir?
Thank you. Thank you very much for inviting me into this very auspicious event, I should say, and I'm very happy and elated to be associated with the Indian Dental Association and the vibrant leaders of the association. I have been working with many professional bodies, but I must say that the relentless work of the IDA leaders, starting right from Dr. Dhoble and all others who are, spread across the country, it is commendable. So first of all, my first congratulations to the team for coming up with such a grand idea, and I really wish a success for this program. The second thing which I would like to inform in this forum today is how IDA has been associated with the National Oral Health Program. We have in the country a program dedicated to oral health in the country, which is known as the National Oral Health Program, which has got 2 components, which are the National Health Mission component, which is the NHM component, we call it, for supporting the dental units at the district hospitals and below facilities. And then we have what is known as the tertiary component, which are the central level activities which we have in the center. So we design a lot of IEC material, organize training workshops, conduct review meetings, and also conduct workshops. And then in order to achieve this, for example, I'm a public health fellow. I'm trying to run a program for the oral health in the country. So I need to be surrounded by dentists who would tell me what is to be done. So in that endeavor, we had Christian, the National Center of Excellence in CDER, the Center for Dental Education and Research in AIMS, New Delhi, which is the National Center of Excellence for the country. And in order to support further in for the National Oral Health Program, we also have envisaged 3 National Resource Centers, the first of which was already inaugurated by the Honorable Health and Family Welfare last Saturday in PGI Chandigarh, which is the National Resource Center for Pediatric and Geriatric Oral Health. The second in the pipeline is National Resource Centers for Tobacco Cessation by Dentists, and the third one is the National Resource Center for Oral Potential Malignant Lesions. So many things we are trying to do together with many premier institutes of the country, and also with association like the Indian Dental Association, and we have achieved some key achievements across the country. Say, for example, we have supported 3,650 dental units across the country, apart from those which are already existing through the state governments and the UTs. And we have also, I'm happy to announce that for the first time, India is also geared towards having a national oral health policy, which is in the public domain. We are expecting the comments to come in the next 2 weeks or so, and then we would be finalizing the national oral health policy. So India would be one country which has a separate national oral health policy. And in order to work very closely with other programs that the National Tobacco Control Program, NCD program, we have also developed a portal called Eden Seva with CDR in AIMS, and we have helped design many operational guidelines for establishment of tobacco cessation centers, and others which are required by the ministry. And this program, which the idea is taken up with the CBSE, I'm also very happy to announce that for the National Tobacco Control Program, we already have a TOFI guideline, which is the Tobacco Free Educational Institute guideline, because tobacco is one of the main risk factors, which is directed towards increasing morbidity and mortality, premature mortality of the country. So we hope to work further with IDA in implementation of the Tobacco Free Educational Institute's guidelines, along with the CBSE officials who are present here. We would be very, very happy to work with one of you, with each one of you. Then we also would like to request IDA to continue to collaborate with us on working on the NCD risk factors of tobacco, alcohol, and physical activity. This is where we would be requesting IDA to work with us, and we'll be happy to collaborate in any of these areas of which have been identified as non-communicable diseases risk factors. Otherwise, as I said, many organizations, it's the ministry requesting them, asking them, let's do this and let's do that, and we invite them in. But with IDA, it is the opposite. The IDA has been the stakeholders, the office bearers of the IDAs are always after us. We are going to do this. You should be part of this. So it is always a pleasure to be part of the IDA platform, and I hope it continues to strive towards its objectives and also help fight many of the diseases in the country, and encourage healthy living in the country. And I'm happy that they are targeting the right population today, the youths of the country, through organizations like CBSE. And I wish you all the best. Thank you.
Thank you, sir. And IDA is privileged to be working with you and being associated with you for so many years. And I think this association will go a long, long way with you. Now, can I, the second guest, special guest for today is Mr. Manoj Ahuja, IAS officer, chairman, CBSE. He is unable to join us, so I would please request Dr. Biswajit Saha to please say a few words in this regard.
I think Dr. Saha got disconnected, Marlin.
Okay. So can I go ahead? Yeah. So we have with us, we are lucky to have amongst us Anamari Hill, Senior Director, Health System Partnership. She is joining us from S.O. International, S.O. Bharat International from South Africa. Can I please ask you to speak a few words, ma'am?
Sure, and thank you so much for the opportunity to say a few words. I'm the Senior Director for Health Systems and Partnerships at Special Olympics International. And I just want to recognize what everyone is doing here today to support the health of individuals with intellectual disabilities. As Dr. Kumar, I'm sure, will explain, IGASIA has helped us to provide a strong platform to reach individuals with intellectual disabilities virtually at this time when we're not able to meet them physically, and ensure that they still get that important oral health education and advice that they require. So we're looking forward to the strong partnership and appreciate the recognition today. Thank you.
Thank you, ma'am. We also have with us Avi from S.O. Bharat Asia Pacific. Can I please request you to please speak a few words? Ma'am, I think you're on mute. Dr. Reena, should I go ahead? I think ma'am is
Yes, please.
not
Yes,
connected.
please. I think you
Yeah?
should. I think you should.
Yeah. Thank you. Now we have with us our very own Dr. Reena Kumar, convener, National School Oral Health Program, IDA-HO. She was a former dean at the Divya Jyoti College of Dental Science and Research, specialized in special care dentistry, sports dentistry, regional clinical advisor, Special Olympics Asia Pacific, secretary of IADH India chapter, national director IDA Special Olympics Oral Health Program, national director Sports Dentistry IDA-HO, convener National Oral Health Program IDA-HO, clinical professor orthodontics, specialist in
Thank you,
tobacco
Merlin.
cessation.
Merlin, thank you very much.
I think it goes on and on.
Thank you. Thank you so much, Merlin. Thank you very much. That's very kind of you for the very warm, introduction that you have given. Today is an amazing day, and warm greetings and a heartfelt gratitude to all our esteemed chief guests and our policy makers from the government, dignitaries from CBSE, S.O International, S.O Asia Pacific, S.O Bharat, and AGASIA for being here to bless and show solidarity with us at IDA for this collaborative campaign which embodies professional commitment and care for all our most precious asset, children. Children who are the foundation of our nation, the future leaders, the creators of our nation's wealth. In any organization can be benchmarked actually by the way we treat our children. And IDA, I think, really takes the cake there. The harsh light shined by the pandemic has actually exposed the gaps in our delivery and preparedness for education and health, especially preventive health, in the case of a crisis. It really, it was so harsh that we all were woken up that how unprepared we were. The call now is therefore for public and private engagement to catalyze sharing and learning, to see how we reimagine health and preventive health education particularly. The process, the reach, and the outcome to become diverse, engaging, and sustainable in this very increasingly complex, uncertain, and fragile world. The pandemic has truly taught us that these fundamental rights, what we call the right to education and the right to health, will really need to be broadened, made more fluid with increased permeability in our society. With more than 21,000 schools affiliated to CBSE board and a huge number of special schools, and of course the inclusive schools are spread across the nation from urban regions all the way to the grassroots in the villages. We at IDA, with your support and solidarity, have embraced digital technology for delivering preventive oral health and sports safety education to our school children and teachers. We thank the vision of CBSE and SO leadership for helping us engage all schools in their boards to this program. We thank Professor Datta for his generosity and care to provide us AGASIA to help make National School Oral Health Program accessible and sustainable to reach and teach our teachers and children in all schools, and the value of the good oral health and sports safety, to be proud of your mouth, the theme of the World Oral Health Day for the next 3 years. I'll just take a quick tour with just a few slides to show you how this program has been built, and so that we get an idea as to what really we are planning to do and how big and how large this entire thinking is from IDA platform, and where, I'm sorry. So with my screen that's visible, of course, the first slide really tells us about where we are today. Today is the World Oral Health Day, and our mouth is the gateway to the rest of the body. And we are here, and IDA is committed to children of the school, of the nation, to be proud of your mouth. For the next 3 years, we are going to take this as our pledge that we are going to be teaching our children to continue to learn and grow and be healthy individuals. The National School Oral Health Program is a highly impactful program, and this program has been dedicated to how we can reach out to all the micro ecosystem of the schools, which is the education system, which essentially consists of the children at the center, the faculty members, the teachers, the parents, and all other stakeholders who are in this organization to ensure that health, preventive oral health, preventive health, general health becomes an important part of the growth of our children. And the National School Oral Health Program has been impacted, as most of the things have been impacted in health, education, and many other sectors of business because of the COVID. So this is the point where we learned that things have to become different, because we saw what the schools did, we saw what our teachers did, we saw what our policymakers of the government, we saw what the CBSE boards, the ICSE boards, all the boards, the Special Olympic schools and the state schools, what did they do? They moved. All the teachers moved straight out of the brick and mortar classroom and went on to adapt to digital mode. So this is where we thought that we need to take the school oral health program also into a digital mode so that it is accessible and sustainable. Because today, in the last 1 year, we couldn't do what we could have done and what we have been doing over the years. But now, if we come in with a digital technology embracing this, there is going to be a different way we are going to look at it. And we are going to be able to reach every school, in every child, in every teacher, in every school, in every part of the country. So this is how it works. So basically, we have created a CBSE workspace. So it is a workspace in Igacia is unique in many ways because it has permanent rooms. These are permanent virtual rooms. And in each virtual room is equipped with a video conferencing system, like we are sitting and doing this, a chat, that is a text messaging, and also a learning management system and a project management system. So in this workspace of CBSE, we are going to be putting in 21,000 rooms, with each unique room being distinctive for each school by the school name as listed out and given to us by the CBSE leadership. So in the architecture of the Igacia, we have a learning management system over here, and there is a folder. So in the folder, the material has already been introduced, which is all systematically arranged, which could be child-specific, age-specific, discipline-specific, whether it is oral health, whether it is general health, whether it is nutrition, sports safety, how to manage injuries, what do you do in case of an injury. So all this material has been placed in this already. So all that a teacher or a doctor has to do now is to log in here, log into Igacia, which is your unique room of your school. The doctor from the region, from the IDA's offices, and from the dental schools, and rightly said by Dr. Biswajit Saha, that we have to log in all the dental colleges, and which IDA definitely has, that we will ask doctors to enter the room and, of course, train teachers, students at different time intervals to their convenience in each one of their own rooms. And the material is kept like this, so it is easily accessible, very simple, and yet very, very crisp and to the point, which kind of tells exactly what is to be done. It is clear and actionable guidelines have been put for the critical role of health is there and entered in here. For our special schools that we have created a separate workspace called Special Olympics Workspace, which has the Special Olympics logo, just the way other one had a CBSE logo. And all the schools have been introduced as a single distinctive room and given the same material, which has been created by IDA. And alongside that, we have also given the material which is very specific to Special Olympics in the form of the HA material and the Special Olympics material, which has been provided by our national office to be included in this. So this is now the whole idea is the teacher or the clinical director or the doctor from IDA can just go into the room, use the material, standardize material, and teach. Tomorrow, when the COVID is gone and we are able to reach our children in the school, even then the student, because Igacia is mobile friendly and it is extremely easy to access this material on the mobile. So even the young doctors who are reaching the schools could use the standardized material and train and talk to the students and to the teachers such that we are delivering standardized material and clear and actionable guidelines are being given out. So I think with this, we realize that if we really need to focus on teachers and parents and be a community-focused service, as we really heard Dr. Swasthicharan say, I think we really need to look at the school settings because it has the widest reach And the public health program is a very impactful program and very high meaningful program. So with this, I would like to thank all our stakeholders for a very shared vision and passion to promote good oral health and sports safety in our children, in our country, starting today. And thank you so very much. Merlin, over to you.
Yeah.
I'm just stopping there.
Yeah. Thank you, ma'am, for running us through the entire program. I think everybody's clear on how the program works and how it's going to benefit so many students across the country. Thank you. Next, we have the chief guest, Srimati Varsha Gaikwad, Honorable Minister of School Education, Maharashtra, Shri Rajesh Tope, Honorable Health Minister, Maharashtra, Shri Ramesh Pokhriyal, Honorable Education Minister of India. They are unable to join due to some immediate meeting that they all had to go to, but they have sent us their heartfelt thanks and a small note to us. They've said that it is a pleasure that IDA, the only dental body, has collaborated with the Special Olympic Bharat and CBSE schools for improving the oral health of children. And they say that it is the right time, it is initiative at the right time, and by making this a part of the curriculum, it will help the students to take charge of their own oral health. The best part of this program is that it does not require for the students to be present and can be learned and trained at the comfort of their homes. And during this pandemic, the digital world has proven to be a boon to mankind, and they are very glad that the IGESHA platform is specifically curated for such a remarkable program. And they're glad that the IDA and CBSE have taken this initiative, and they hope to create a better environment for students, thus improving the oral health scenario in the country. We thank you. We thank our chief guest for such kind words and for taking their time and giving us this write-up. And if we want, we would actually send it to all our members so that they can read their individual messages across. Next, I go to Dr. Rajiv K. Chuk, Chairman, Reception Committee, IDA Centenary Celebrations. So can I please ask you to give an overview of the launch of the program?
Thank you so much. President of IDA Head Office, Dr. Ravinder Singh, Secretary General, Dr. Ashok Doble, dignitaries from the Ministry of Health, Government of India, Ministry of Education, Government of India, and dignitaries from the Maharashtra Government, Department of Education and Health, dignitaries from CBSE, Special Olympics, and my dear friends. It's a very unique kind of project which IDA has collaborated and started today. And I think this could have not been possible without the efforts of our President, Secretary General, and of course Dr. Reena Kumar, who has been the brain behind all this. This is a great initiative because in this pandemic time we had an opportunity to, and then we realized that it was not possible to reach out to the students in the schools by physical presence and educate them on dental education. And this digital platform, which has been created for this purpose, is unique in that sense. And for the years to come, it will be a very beneficial program. IDA has always been taking initiative related to the public health, the social health, and I think this opportunity, this endeavor of IDA, where we are trying to reach out to the students, laying a foundation for good oral hygiene, and through them also to reach out to the families of those children, where we can educate the importance of not only the oral health but general health. And if we are able to reach out through this platform to 21,000 schools, CBSE schools all over the country, I think it's a great kind of platform we have created so that we are able to educate the general health as well as the oral health. And in the coming years, we can elaborate this further to include the teachers and then reach out to youth also. So I would like to thank the team of IDA, the team from Special Olympics, and of course, it could not have been possible without the efforts of CBSE for allowing us to reach out to the students and schools. Thank you so much for all those who are associated with the program, and wish all the best to the organizers. Thank you.
Thank you, sir. Now I introduce Dr. Manish Verma, Chairman CDH at IDA-HO, to please give the vote of thanks.
Thank you, Dr. Malin. Good evening, one and all. For almost more than 4 decades, IDA has been pioneer to provide the oral health education in India. Today, we are witnessing an historic occasion on the launch of digital platform for oral health and sports safety in collaboration with the CBSE and Special Olympics Bharat. Dr. Ashok Doble, we express our sincere gratitude and humble thanks to Chief Guest Shri Ramesh Pokhriyal, Honorable Education Minister of India, Shri Rajesh Tope, Honorable Minister of Health, Government of Maharashtra, Srimati Varsha Gaikwad, Honorable School Education Minister, Maharashtra Government, for inaugurating and giving blessings for this program. We are also thankful to Mr. Manoj Ahuja, IAS, Chairperson, CBSE Delhi, Dr. L. Swasthicharan, Chief Medical Officer, DGHS, New Delhi, for kind support for this initiative and gracing the occasion as guest of honor. Also, we'd like to thank and acknowledge Air Marshal Keelor, CEO and Founder Trustee, Special Olympics Bharat, Mr. Dipak Nitali, President and MD, Special Olympics Asia Pacific, Professor Sumit Datta from Cornell University, for their kind support and being special guest of this important occasion. Last but not the least, we'd like to thank and acknowledge all the eminent panelists, Dr. Vishwajit Saha, Director School Education and Training, CBSE, Dr. Joseph Emmanuel, Director Academics, CBSE, Dr. Amitav Mishra, General Secretary, Special Olympics Bharat, Mrs. Mukund Thin, National Director, S.O. Bharat, Dr. Reena Kumar, Convener, NOHP ID Head Office, and Dr. Rajesh Tope for their valuable inputs and gracious presence on this occasion. Also, I would like to acknowledge support of Mrs. Nupali and Dr. Marlin for all the back office support and for conducting this program. Thank you one and all. Jai Hind, Jai IDA.
Thank you, sir. Here we come to the end of the program, and it was a great opportunity for me to be hosting this program for you all. And we at IDA-SO Bharat are very, very proud and really happy to be a part of this amazing program. I would request you all to please, keep your cameras on so that we can have one group picture since we're on a digital platform. So if you could kindly on your cameras, please. Thank you, everyone. You've got a good click. Yeah.
Thank you very much, Merlin, for conducting it beautifully. Thank you, Rupali.
Thank you.